You are a new nurse, AJ. Are you excited to start your first day? Well, hold on there, Slick. You're gonna need a few things first. Change into your scrubs. Great. Now you need a stethoscope. Wonderful. And a couple more things to fill your pockets. No, not that full. That's not safe. Well, you're all ready now, AJ. Or should I say, Nurse AJ? Okay, Nurse AJ, let's get started. Around you are all the nursing supplies you'll need in your adventure as a nurse. What? Nurse AJ, you look confused. Oh, you're wondering about those clear bags of water in front of you? Oh, those aren't water, you novice nurse, you. Those are bags of IV replacement fluid. Sometimes, when patients need hydration, we need to use these little babies. I'm surprised you didn't learn about this in nursing school. It's okay, Nurse AJ. Let's learn from our 4 beautiful nurses about the 4 most important IV fluid replacements you will use in your career as a nurse.
Lactated ringers. 0.9% normal saline. 0.45% normal saline. 5% dextrose.
Here we have Nurse Lorena, who's the expert on 0.9% normal saline. Maybe she will share some of her knowledge with us. Well, Nurse AJ, normal saline is 0.9% sodium chloride in water. It is an isotonic crystalloid solution used for fluid imbalances due to dehydration. It is the only IV fluid that can be used in conjunction with blood products. It can be used in resuscitation efforts and to increase IVF and replace ECF fluid losses. Do not use normal saline on patients with cardiac or renal compromise. Well, that about does it for now. Thank you, Nurse Lorena. You certainly know your nursing skills. Nurse AJ! Nurse AJ! Oh, where did you get off to? Okay, well, Nurse AJ, we have to learn about more fluids. Get out here. Oh, Nurse Parveen. Oh, I'm so glad you're here. Do you have some time to teach us about half normal saline, or as we call it in the biz, 0.45% normal saline? Thank you so much. Well, 0.45% normal saline is a hypotonic crystalloid solution of sodium chloride dissolved in sterile water. This fluid is designed to treat cellular dehydration caused by such conditions as hypernatremia or diabetic ketoacidosis. It is always avoided in patients with burns, trauma, or liver disease because of its tendency to deplete intravascular fluid levels. Infusing half normal saline causes water to shift from the extracellular fluid compartment to the ICF compartment. Side effects include redness, pain, or swelling at the injection site. Nurse Parveen, how informative. Thank you so much for your instruction. Nurse Jen. Sorry, Nurse Jen. Wow, what a beautiful baby dextrose. Well, Nurse Jen, it looks like you have a lot of information for us on 5% dextrose in water. Would you mind taking the time to share with us? Thank you, Nurse Jen. Well, 5% dextrose in water, or D5W, is a crystalloid isotonic carbohydrate solution that contains glucose as the solute. Once glucose is quickly absorbed and utilized for energy, it becomes hypotonic because glucose is absorbed and water is left. D5W rehydrates and increases total fluid volume. It provides 170 to 200 calories per liter, and in the case of a diabetic hypoglycemic patient who is NPO, it is the fluid of choice. Caution! Can cause fluid overload in renal failure and heart failure patients, or can cause cerebral edema for patients at risk for intracranial pressure. Thank you, Nurse Jen. We know so much about that very important fluid now. Well, Nurse Rachel. Oh, the bag is here, but where is Nurse Rachel? Yoo-hoo! Yoo-hoo! Oh, there you are. Nurse Rachel, could you teach us a little bit about lactated Ringer's solution? Thank you. Well, Ringer's lactate solution, or lactated Ringer's solution, is a type of isotonic crystalloid fluid, further classified as a balanced or buffered solution used for fluid replacement. The contents of Ringer's lactate include sodium, chloride, potassium, calcium, and lactate in the form of sodium lactate, mixed into a solution with an osmolarity of 273 milliosm per liter and pH of about 6.5. It is the fluid of choice for rapid fluid resuscitation, including trauma or burn victims. The risks associated with using lactated Ringers are worsening hyperkalemia, worsening lactic acidosis, or hypercalcemia. It is contraindicated in blood administration due to formation of calcium citrate precipitate for those in diabetic ketoacidosis and for those in cirrhosis due to inability of the liver to process lactate. Thank you, Nurse Rachel. How very awesome. Nurse AJ, now that you have all of this new information, do you think we can test your knowledge? What do you think, friend? I can't hear you. Oh, do you need to phone your friends in the class? Hey, class, let's help Nurse AJ find the right fluids. Our first patient is a diabetic patient who is NPO and needs fluids. What should we give them? If you guessed D5W or 5% dextrose in water, then you're right. Our second patient has had a hemorrhage after cardiac surgery. His doctor has ordered a blood transfusion. What fluid should we give them? .9% normal saline. That's the one. This patient is a burn victim who is severely hypovolemic. Which fluid do they need? Yes, lactated Ringers. Good job. Finally, our last patient is hypernatremic and requires hypotonic fluid replenishment. Which fluid does this patient need? Woohoo! You did it. It's 0.45% sodium chloride. Great job, class.